Sarah, 32, marketing executive, sits with a sandwich and soup. She's been tired lately, but brushes it off. She takes a bite. Halfway through lunch, her stomach tightens. Sarah, to coworker.
Ugh, not again. This sandwich is killing me. Still not feeling well? I swear I've had food poisoning 6 times this month.
She's curled in bed, cramping, bloated, pale. Her skin looks dull, lips dry.
Sarah texting her sister, I can't take this anymore. I think something's seriously wrong.
Ellis, kind and sharp, listens attentively. Tell me what's been going on.
Constant bloating, stomach cramps, fatigue like I've run a marathon, and weird weight loss. I'm eating, but I feel worse every time I do.
Do you notice if it's worse after certain foods?
Now that you mention it, bread, pasta, anything with flour, even some soups.
Ellis nodding. Let's run some tests, including something called a TTGIGA blood test. Based on your symptoms, I want to rule out celiac disease.
Clinic. Follow-up visit. Dr. Ellis sits across from Sarah with lab results.
Your blood test was positive for antibodies linked to celiac disease. We confirmed it with an endoscopy. You do have it.
Okay. What does that mean?
Celiac disease is an autoimmune disorder. When you eat gluten, a protein found in wheat, rye, and barley, your immune system attacks your small intestine. This damages the villi, tiny finger-like projections that absorb nutrients. Over time, this leads to malabsorption, which causes all the symptoms you've been feeling: fatigue, weight loss, stomach pain, even skin issues and brain fog.
So, I'm allergic to gluten?
Not exactly. An allergy would be different. This is an autoimmune reaction. Even tiny traces of gluten can cause serious damage.
Sarah's kitchen. Days later, she's organizing shelves, reading ingredient labels, tossing out old sauces and bread.
I had no idea something so common could wreak so much havoc. It's not just about cutting bread. It's about changing how I live, eat, travel, even shop. But now I understand my body. I'm finally healing.
Celiac disease is a chronic autoimmune disorder. When people with celiac disease eat gluten, a protein found in wheat, rye, and barley, their immune system mistakenly attacks the lining of the small intestine. This immune reaction damages the villi, small finger-like structures that absorb nutrients. Without healthy villi, your body can't absorb nutrients properly, leading to malnutrition and a wide range of symptoms. Celiac disease symptoms can vary widely, especially between children and adults. In adults, bloating, gas, and abdominal pain, chronic diarrhea or constipation, fatigue and weakness, unexplained weight loss, anemia, especially iron deficiency, bone or joint pain, skin rash, dermatitis herpetiformis, headaches or migraines, depression or anxiety, brain fog or trouble concentrating, infertility or miscarriage in children, delayed growth and puberty, irritability, vomiting or bloated belly, poor weight gain, dental enamel defects, behavioral issues. Diagnosis typically involves 1. Blood tests, tissue transglutaminase antibodies, TGIGA, total IgA, other antibody tests if necessary. 2. Endoscopy with biopsy. A small sample is taken from the small intestine to confirm damage to the villi. Important: do not stop eating gluten before testing. Removing it can lead to false negative results. Gluten is a protein found in wheat, bread, pasta, baked goods, rye, barley, beer, malt. Many processed or packaged foods, even tiny amounts, can trigger damage in someone with celiac disease. There is no cure, but the condition is managed by following a strict lifelong gluten-free diet. This means avoiding all forms of wheat, barley, and rye, checking labels for hidden gluten ingredients, preventing cross-contamination, shared kitchen tools, fryers, etc. Taking supplements for nutritional deficiencies, if needed, regular checkups to monitor healing and symptoms. If left untreated, celiac disease can lead to osteoporosis, infertility, neurological issues, nutrient deficiencies, increased risk of certain cancers, liver disorders, delayed growth in children. Celiac disease is genetic. It often runs in families. People with other autoimmune conditions, like type 1 diabetes or thyroid disease, are at higher risk. If you experience chronic digestive issues, fatigue, unexplained weight loss, anemia, or persistent skin rashes, speak to your healthcare provider and ask about celiac disease testing.